shift tinnitus, and the different ways that we can prevent noise-induced hearing loss, okay? And we'll be discussing how loud is too loud. Again, I'm located in the San Francisco campus, and here are the rest of the faculty and staff, some of which you might have had the pleasure of seeing at our clinic. So here's the rest of our faculty and staff members in the San Francisco campus. We also have presence in the Stockton campus, where Dr. Gale is the audiology clinic director, and there's also a few clinical faculty and staff members there as well. So before we get started with the presentation, I just want to make note that this month of May is Better Hearing and Speech Month, so it's perfect timing to have this webinar. This month is dedicated to raising awareness for communication disorders involving hearing, speech, and language. It's also a great time to get your hearing tested, introduce treatment options for those who already have hearing loss, and also to inform you about the things you can do to protect your hearing. So here's today's agenda. I will first give an overview of sound and how we hear. Then I will talk about noise-induced hearing loss, what causes it, and the factors that affect individual susceptibility. Effects of noise exposure, including hearing loss and tinnitus, and the different ways we can prevent noise-induced hearing loss. So hearing protection devices, such as earmuffs and different types of earplugs. I will end the presentation by discussing two commonly frequently asked questions related to noise exposure. So noise exposure during concerts and when using headphones and earplugs for music. So that's just an outline of what I'll be talking about in this presentation. So I'll get started with what is sound. So sound we know is made up of vibrating air molecules that we can hear. These sound waves are formed by objects vibrating, so shaking back and forth. Sound waves travel through air, water, and solid objects as vibrations. And we measure sound intensity, so how loud a sound is, in units, what we call decibels. So it's a measure of pressure or forcefulness of sound, so how loud the sound is. So let's take a look at how we hear, okay? So first, sound is present and the waves enter the outer ear and travels through the ear canal that leads to our eardrum. So here we have our ear canal and sound is traveling through the ear canal to our eardrum. The eardrum vibrates and sends the vibrations to the three small bones in the middle ear, which are known as the ossicles. So here are the ossicles of the middle ear. The middle ear ossicles amplify the sound vibrations and then sends them to our organ of hearing, known as the cochlea. So here is the cochlea. When sound goes into the cochlea, hair cells send a wave of energy to the auditory nerve, and then the responses are carried to the brain for our interpretation. Okay, so that's just an overview of how the auditory system works and how we perceive sound. So what is noise-induced hearing loss? So in abbreviation, noise-induced hearing loss, we abbreviate it as NIHL. As indicated in the terminology, it's when an individual loses their hearing due to loud noises. So every day we experience sounds in our environment, such as the sounds from our television, radio, household appliances, traffic, and so on. Normally, these sounds are at a safe level that don't damage our hearing. However, sounds can be harmful when they are too loud, even for a very short, brief period of time, or even when they're both loud and long-lasting. So these sounds can damage the sensitive structures in the inner ear, called hair cells, and cause noise-induced hearing loss. Noise-induced hearing loss can be immediate, or it can take a long time to be noticeable. It can both be permanent or temporary, and it can affect both one ear or both ears. Even if you can't tell that you're damaging your hearing at the moment, you could be having trouble hearing in the future, such as not being able to hear other people when they talk, or having difficulty hearing in background noise. Regardless of how it might affect you, the one thing is certain is that noise-induced hearing loss is the one type of hearing loss that you can prevent. And again, I will talk about how we can do this later on in the presentation. In the last slide I mentioned, I mentioned that loud sounds can damage the sensitive structures in our ear and cause hearing loss. One of the major structures responsible for hearing is our hair cells. So hair cells are the sensory cells in the auditory system, and they help to transform sound into electrical signal. Most cases of noise-induced hearing loss is caused by damage and eventual death of the hair cells. So in the picture to the left here, we see a scanning electron microscopy image of very nice, sturdy rows of hair cells in a healthy cochlea. And next to it, we see a damaged cochlea with hair cells that have fallen over, bent, or they're even missing. The same thing in the picture to the right. So this is a picture of the nuclei of the hair cells. So this is taken using confocal microscopy. So in the healthy cochlea, we see 3 very neat rows of outer hair cells. So these are outer hair cells right here, and this is a row of inner hair cells. After noise exposure, we see that the hair cells die and are missing, as indicated by these arrows right here. So these show that hair cells are missing, and we also see very small condensed nuclei, so meaning that these cells are in the process of dying. So they're in the process of apoptosis. So unlike birds and certain amphibian hair cells, the hair cells in humans do not regenerate. So once they die, they're gone permanently. So who is affected by noise-induced hearing loss? People of all ages can be affected by noise exposure, including children, teens, young adults, and older people. So they can all develop noise-induced hearing loss. At least 10 million adults, so about 6% in the United States, under 70 years old, have features in their hearing tests that are indicative of hearing loss in one or both ears from exposure to loud sounds. Okay, so while adults are at highest risk of noise-induced hearing loss, the rapid increase in headphone and earbud use in kids, among kids and teens, means that they're at risk too. So researchers have also estimated that as many as 17% of teens, ages 12 to 19, have features in their hearing test indicative of noise-induced hearing loss in one or both ears. Again, what causes noise-induced hearing loss? We know that noise-induced hearing loss is caused by exposure to loud sounds. Okay, so this can be caused by being around loud noises for over a long period of time, such as machine noise at work, or exposure to a single loud noise in a very short period of time, so such as gunshots or explosions. Noise-induced hearing loss can be caused by both recreational and occupational noise, such as working with machinery or at a loud factory. And the recreational noise exposure can be due to loud hobbies. So these loud hobbies include things like hunting, shooting, listening to loud music, attending concerts, playing in a band, lawn mowing, woodwork, and so on. So these loud sounds overstimulate the very delicate hair cells, and this leads to the permanent injury or the death of these hair cells. Although everyone is at risk for noise-induced hearing loss, some individuals may be at higher risk due to their genetic background. Okay, so noise-induced hearing loss is a very complicated disease that results from the interaction of genetics as well as the environmental factors. Some people inherit genes that make them more likely to develop noise-induced hearing loss, and scientists are working to figure out which genes increase the risk. Today, the development of what we call the high throughput genotyping methods allow detection of hundreds and thousands of single nucleotide polymorphisms or genetic variations in a single array that will help identification of new genes that allow individuals to be more susceptible to noise. This in turn will contribute to development of genetic testing that will allow for better protection of noise exposed individuals, as well as personalized treatment. There are many biological factors as well that influence a person's susceptibility to noise-induced hearing loss. This includes sex. So males are at higher risk as compared to females. Also age. So older folks are more susceptible as compared to younger individuals. A person's genetics. So certain genes can exacerbate hearing loss or have hearing loss as part of the genetic mutation. A person's general health is also very important to consider because there are diseases that can have auditory involvement. And lastly, exposure to ototoxic agents. So ototoxic agents can include medication as well as workplace chemicals. So ototoxic chemicals can affect hearing. Some of them can cause hearing loss even without simultaneous excessive noise exposure, and others interact with noise to create this synergistic effect that increases a person's risk for noise-induced hearing loss. Medications such as chemotherapy drugs, cisplatin, carboplatin, in combination with noise exposure can exacerbate the hearing loss. And ototoxic chemicals in the workplace can pose a risk to hearing. And some examples of these chemicals include heavy metals like lead and mercury, and certain solvents such as styrene and carbon disulfide, and many others. So now that we know that loud noises cause hearing loss, let's take a look at the common noise levels. Again, sound intensity is measured in units called decibels. So the higher the decibel value, the louder the sound is. So as we can see here in this picture, a typical conversation is about 60 decibels. A subway platform or a very busy city is about 90 to 95 decibels. And a jet engine taking off can be extremely loud, so about 140 decibels. So, you know, just to see the relative decibel level, something like a whisper would only be around 30 decibels. So how loud is too loud in this case? So this leads us to our next slide, looking at the extent of damage to your hearing caused by noise exposure depends on three major factors, okay? So we have the decibel level, how loud is the sound? The distance, how close are you to the source of the sound? And lastly, we have the time, the length of time that you're exposed to this loud sound. So how long are you exposed to this loud sound? So the louder the sound, the more damage it can cause to your hearing, and the quicker this damage will occur, okay? Sounds at around 70 dBA are considered generally safe, and any sound above 85 dBA are more likely to damage your hearing over time. Researchers have found that people who are exposed to long periods of noise at 85 dBA or higher are at much higher risk for hearing loss. So that's why workers are required to wear hearing protectors when in an occupational setting, such as earplugs or earmuffs on the job. In terms of distance, a sound gets louder as you move closer to the source and softer as you move away from it. So if you're far away from the sound, the risk of damage to your hearing is much lower. So at concerts, for instance, sitting away from the speakers will reduce your risk. And lastly, in terms of time, so the impact of noise, interestingly, adds up over a lifetime. So if you're exposed to loud sounds on a regular basis, for example, at a workplace, your risk for permanent damage increases over time. So even a single but long-lasting event can cause substantial damage to your hearing. So how loud is too loud? We have two government entities, so OSHA and NIOSH, that set legal limits on noise exposure in the workplace. So OSHA stands for the Occupational Safety and Health Administration, and NIOSH stands for National Institute for Occupational Safety and Health. So these limits are based on a worker's time-weighted average over an 8-hour day. Okay, so with noise, the OSHA's permissible exposure limit is 90 dB for all workers for an 8-hour day, which means that exposures at or above this level are considered hazardous. So the difference between NIOSH and OSHA is the exchange rate. So OSHA, we see here, uses 5 dB increments, so 85, 90, 95, 100, and so on, while NIOSH uses 3 dB increments. So they go from 82, 85, 88, 91, and so on. So according to each governing body, a person can safely be exposed to each intensity level for its corresponding time without the risk of noise-induced hearing loss. So for example, let's look at this OSHA table. So according to the OSHA standard, a person can withstand an environment of sound levels at 95 dB for 4 hours. Okay, so after 4 hours at 95 dB, they become at risk for noise-induced hearing loss. Next, let's take a look at the effects and the signs of noise-induced hearing loss. So depending on the cause of your noise-induced hearing loss, whether it's gradual, so you've been working at a factory or with machinery for 20, 30 years, or if this was a sudden onset, so maybe you were near an explosion or you attended a very loud concert. So depending on the cause, the symptoms may be immediate, or this might develop over time. Some of the most common symptoms of noise-induced hearing loss include decreased hearing, inability to hear high-pitched sounds, muffled or distorted speech. You might also have what we call noise-induced tinnitus. So that's ringing or buzzing in the ear or around the head. You might also experience oral fullness, so the feeling of pressure in the ears, and also otalgia, so ear pain. Noise-induced hearing loss symptoms might last minutes, hours, or days after the noise exposure is over. So in terms of the hearing loss caused by noise can be just temporary. For some people, hearing returns to its normal limits after 16 to 48 hours after exposure to loud sounds. Recent research suggests, however, there may be still long-term permanent damage, even though it's not noticeable or detectable immediately. So even if your hearing returns to normal, the cells in the inner ear may still be destroyed. So if enough healthy cells are left, your hearing will eventually come back. But as more cells are destroyed over time, hearing loss can become permanent. Again, loud noise exposure can cause tinnitus, which we experience or describe as ringing, buzzing, or roaring in the ears or the head. And that is one of the initial signs of damage after noise exposure, which is the presence of tinnitus. Tinnitus may subside over time, but this can sometimes continue constantly or occasionally throughout a person's life. Continuous exposure to loud noise can aggravate tinnitus, and patients may perceive an increase in loudness or even a change in pitch of their tinnitus. Most people who have a long history of noise exposure complain of tinnitus that's tonal in quality and that is high-pitched. So in general, the presence of tinnitus after noise exposure, regardless of whether you feel like your hearing has changed or not, means that the noise exposure has altered your auditory system. In our last hearing healthcare webinar, I was mainly focused on tinnitus, and this slide I'll just review again on how to relieve some of this noise-induced tinnitus. So if tinnitus is bothersome enough, or if it begins to impact the person's quality of life, the person will usually seek medical attention from an audiologist. So currently, there are many therapies used to alleviate the tinnitus, including hearing aids, sound therapy, different types of counseling or behavioral management techniques, stress reduction, stress management, and there are many others. So if you're unsure of where to start, the first step might be to get your hearing tested. So if your audiologist determines that you have hearing loss and that you're a candidate for hearing aids, having a trial period with hearing aids is often recommended. Not only will the hearing aids help you hear better, but it can also offer some relief from your tinnitus. So there are some applications or programs in the hearing aid that can introduce some background noise or some Zen tones that can help you suppress or reduce the perception of tinnitus. In other cases, things like mindfulness can also help. So mindfulness is being aware of the sensations and allowing the present moment to unfold without judgment, involving elements of stress management techniques such as yoga, breathing exercises, and meditation. And we also have a very common or very popular therapies, tinnitus retraining therapy and cognitive behavioral therapy, which help to address the individual's reaction to tinnitus by challenging the negative reactions and restructuring the patient's thoughts. So these techniques or therapies are all available at an audiology clinic. Moving away from the tinnitus and going back to the hearing, so after noise exposure, a person's hearing can decrease, and this is called a shift in the person's hearing threshold, okay? So the hearing threshold is the softest sound a person can hear. After noise exposure, the ear's sensitivity will decrease and there will be a shift in hearing, and this shift may be permanent or temporary. So we've probably all experienced a temporary threshold shift, also known as TTS. So when you attend a concert and when you leave the arena, you might feel that you aren't hearing as well as when you entered or when you initially went to the concert. Sounds may be muffled, your ears might feel full, and you may also experience some ringing in your ears. So this is what is known as the temporary threshold shift. So the recovery time for this varies. It can take a few hours or last for a few days. The longer, the more intense the noise exposure, this will cause a longer lasting temporary threshold shift experience. And there are other factors that can also play a role in the experience. So this includes the person's age, sex, prior history of noise exposure, use of ototoxic medications, and so on. So these symptoms, including, the slight changes in hearing, the oral fullness, so the fact that your ears feel full, and the tinnitus, are indications that you have damaged your auditory system. So repeated episodes of temporary threshold shift could lead to permanent damage to your hearing. So after prolonged exposure to noise, there may be permanent damage, as I just explained, in the inner ear. So a permanent threshold shift results in permanent hearing loss. Okay, so it's highly recommended to have a hearing test to measure how severe the hearing loss is and whether treatment options such as hearing aids are needed. So below here is an example of permanent threshold shift in a group of weavers that were exposed to 102 dB of noise. Okay, so this is at a work environment. The different colored lines represent the number of years that the weavers have worked. And as you can see, the longer they've worked in the noisy environment, the more hearing loss they have. So the green line on top is less than 1 year. And the red line on the bottom are the very experienced weavers that have worked for 35 to 39 years. So when is it too loud? So here are some signs that your hearing is at risk. So when you're at an event, if you have to speak up, or if you have to keep moving closer. So these are signs that it's too loud. After the event, if your speech sounds become muffled, you've likely damaged your auditory system. And also if your ears start to hurt, so ottalgia. And if you're experiencing ringing in the ears, so these are signs that what you've experienced was too loud for your ears. Other harmful effects of loud noise exposure include stress, anxiety, insomnia, even after when the noise exposure, even after when the noise stops. It can also lead to systemic effects such as high blood pressure, increased heart rate, and as a result of having difficulty hearing or tinnitus, individuals might become more isolated, leading to depression and social isolation. So not only does loud noise exposure cause difficulties and hearing impairments, this can also lead to other systemic troubles. Moving on to the second part of my presentation. So now that we learned a bit about noise exposure, what causes noise exposure and the different symptoms associated with it, let's talk about how we can prevent noise exposure. So noise-induced hearing loss is the only type of hearing loss that's completely preventable. So you can easily remove yourself from the noise or protect your ears from the noise. So if you understand the hazards of noise and how to protect and how to practice good hearing health, you can very well protect your hearing. So here's how. So knowing which noises can cause damage, so how loud will the noise have to take to cause damage to our ears, protecting our ears when being involved in loud activities, so wearing earplugs or other protective devices such as earmuffs. If you can't reduce the noise or protect yourself from it, move away from it, okay? So if you're at a loud concert, you can take a step back from the speakers at the front and be alert to the hazardous noises in the environment. We can also protect the ears of young children who are too young to protect their own ears. So if you're outside and it's too loud, we can always provide earmuffs to our young children's. Education, so educate friends, families, colleagues, and allow them to be aware of the hazards of noise exposure, just like what I'm doing with this presentation. And lastly, get your hearing tested if you think you might have hearing loss, because there are treatment options such as hearing aids. In the next few slides, I'll be talking about different types of hearing protection devices, so earplugs and earmuffs. So the one way we can protect our hearing from loud noises is to wear hearing protection devices. And two main common types are earplugs and earmuffs, okay? And here's a example of an earmuff, and there are different variations to earplugs. We have the standard earplugs and different types of custom earplugs, musicians earplugs, and so on. So earplugs, I'm sure you all have seen these in one way or another. Is a foam-like device that's inserted into an individual's ear canal to protect them from loud noise exposure. So these are mostly manufactured from soft plastic or PVC, so polyvinyl chloride foam. So these are the foam plugs, and polyurethane. So these are materials that make up these earplugs. They provide very good sound attenuation when fitted correctly. And the types of earplug chosen will depend on the individual's need and the personal preference. There are something called custom earplugs. So custom earplugs can be made with the help of an audiologist and can be done at our San Francisco and Stockton campuses in the audiology clinic. The audiologist will take an impression of your ear, like so, and send it out for a company to make the earplug. Most of them are made from a silicone semi-flexible material that fits perfectly into individual ears. So these type of earplugs offer the most personalized sound attenuation and fit because the earplugs are molded for the exact shape of your ear. There are also different types of custom earplugs for different activities. This includes sleep, musicians earplugs for music, sports earplugs for things like hunting, shooting, and even swimming. So next we have musicians earplugs. So these are developed specifically for musicians and production individuals who are exposed to unsafe sound levels but require high fidelity sound. So unlike the muffled sounds of over-the-counter foam and the unfiltered earplugs, these musicians earplugs are made with music in mind. So it's perfect for concert goers, and it helps to deliver very balanced sound reduction with very little disruption of the frequency response. They also have this interchangeable removable filters from about 9 to 25 dB attenuation that allows individuals to adjust the level of attenuation to fit their needs. So the greater the attenuation value, the more sound it will block. And lastly, we have earmuffs. So earmuffs are these hard plastic cups that fit over and surround the individual ears and are sealed to the head by these cushion seals, okay? So there are some advantages to earmuffs. So they're designed to fit most people. There are various noise reduction ratings available. They're reusable, durable, and longer lasting than most earplugs, especially the non-custom foam ones. However, there are some disadvantages with workers with heavy beards or those who wear glasses. Those folks might find it difficult to get a good seal from the earmuffs. So the hair and the temples from the glasses will break the seal that the earmuff cushion makes around the ear, and therefore allowing some sounds to still get in the ear, even though you're wearing the earmuffs. When you purchase earplugs or earmuffs, you might notice on the package that there's a noise reduction rating, or the NRR. So this NRR value is a measure of the effectiveness of hearing protection device to reduce noise levels. So the higher value indicates greater noise reduction, and these values range up to approximately 30 dB, and especially when used correctly. Okay, so when used as directed is very important here, because if you're using the foam earplugs and you're not placing them deep enough, you won't get the noise reduction as expected on the packaging. So we have to make sure that although we have the tools to protect our hearing, we're using them correctly. So now I'm going to talk about some phone apps to measure sound level. Fortunately, you don't have to rely on your best judgment in order to know how loud your environment is. So thanks to modern technology, your smartphone can measure sound intensity to determine if your environment exposes you to harmful noises that might cause permanent or temporary noise-induced hearing loss. So there are apps for both the Android and Apple users. Here are some of the examples of the apps that are very well known. So you have Decibel X, SPL meter stands for sound pressure level. Also something called Too Noisy Pro, and last one is a sound level meter developed by NIOSH. So typically when you use one of these apps, you will survey the sound in your environment, and it will give you the intensity level of the sound of the environment. So here we see that's 85 dB. So to wrap up the presentation, I will talk about two common frequently asked questions. So the first one being, can attending concerts affect my hearing? So we know that average concerts range from 100 to 120 dB, depending on where you are standing. So the louder the sound, the shorter amount of time it takes for the noise-induced hearing loss to occur. In most cases, noise-induced hearing loss resulting from a single concert attendance is temporary and should go away within a few days. However, if you're attending concerts on a regular basis, the loud noises can cause permanent tinnitus as well as hearing loss. So hearing protection at loud concerts, the first thing we would recommend is to wear hearing protection. So wearing earplugs is the best way to protect your ears. If you attend concerts regularly, you might want to invest in custom earplugs. So these are the ones that musicians use, and they don't affect sound quality in any way. So try not to use things like napkins or tissues since they won't protect your ears from the very loud, intense sounds. Secondly, stay at a safe distance from the speakers, so at least 25 feet from the stage. And third, take breaks when from the area where the music is loudest. So the longer exposure to loud music, the greater the risk. So you might want to take a trip to areas where the music is quieter for your ears, and this will decrease the chance of permanent hearing damage. So the second common question that people have is, can headphones and earbud use affect hearing? So headphones don't have to be extremely loud to damage your ears. So even listening to headphones or AirPods, earbuds at a moderate volume can damage your hearing over time. And And that's because your ears are not just damaged by the loudness of the noise, but also the length of exposure as well. So recently, use of headphones, earbuds has led to a major increase in the prevalence of noise-induced hearing loss, including in the adolescent young adult population. The WHO, the World Health Organization, estimates that 50% of individuals 12 to 35 years old are at risk of hearing loss due to prolonged and excessive exposure to loud music with headphones and earbuds and so on. So the key danger of headphones is the volume. Okay, so the fact that they can produce very loud levels of sound very close to your ears. So this is dangerous in general because the loud noises are damaging to, again, the hair cells in the ears. So how can we avoid hearing damage from earphones and headphones? Turn down the volume from the devices. So limit the exposure, can protect your ears. Use of noise canceling headphones. So noise canceling headphones can block external sound and let the listener enjoy music at a lower volume without distractions. So this will prevent the listener from cranking up the volume. Using over-the-ear headphones instead of in-ear or earbud style models. So over-the-ear headphones can increase the distance between the eardrum and the speaker. Okay, so distance, as I mentioned earlier, is very important. And lastly, reducing the listening time. So there's a 60-60 rule. So don't listen at louder than 60% of maximum volume for any longer than 60 minutes at a time. So these are all very good ways that if you enjoy listening to music or listening to podcasts through your headphones or earbuds, these are some ways that you can avoid noise-induced hearing loss. So there are custom earplugs available at the UOP clinic in both the Stockton and the San Francisco offices. So the regular custom earplugs, shown here without any filters, are $250 a pair, and if you only want one, it'll be half the price. Musicians earplugs with filters, again, so these filters, you can change them depending on how much noise you want to reduce. So they're $300 a pair. And more recently, we also have these high-end hearing protection solution from Phonak. So there's options for music, hunting, shooting, motorsports, work, sleep, and comfort. And the price ranges depending on which option you choose, and ranging from $26 to $62 for a pair, and they look like this. Okay, so this is all I have for today. I'd now like to open it up to any questions that you might have. Please feel free to type them in the chat box.